ARCHway ignites hope through its Advocates for Hope program. This program is designed so that peers who are thriving in recovery and caregivers who have been impacted by a loved one's addiction can offer compassionate and caring conversations to those struggling with substance use disorders. They also work hard to connect these individuals and families to the right resources, support, and life-saving care needed to initiate a pathway toward long-term recovery. This peer-to-peer support means that those with lived experience can come alongside that person and help lift them up in their recovery. It's for this reason that I'm excited to present tonight's Community Award. This award is being presented to PreventEd, leaders in prevention in the eastern region of Missouri. They are receiving this award for their ability to incorporate peers into their community prevention work. Most recently, they have started a peer network in Franklin County in order to increase access to treatment and recovery resources in that community. It's for this reason that they're receiving the award tonight. Here tonight to accept this award is Jenny Armbruster, Deputy Executive Director of PreventEd, and Nichole Dawsey, Executive Director of PreventEd.
Thank you.
Thank you so much. In 2019, we had a staffing kind of availability, and we could go more of the traditional route, but we put our heads together and decided that we instead wanted to explore the opportunity that peers presented. And so we put our heads together with John, and he had all the great ideas, as he often does. And he brought along several peers to help us with adolescent assessments, to help us with adult assessments, and to help us with community trainings. So since then, we have worked with Colton, and he's been out in the field providing specialized training to first responders, to people who work with adults and kids specifically to identify overdoses. But then also we've been working with Jordan, and he has been our boots on the ground in Jefferson County, working with teens who have started to experiment with substances. We could not be more grateful for our partnership and wanted to keep it going. So that led us to Franklin County.
So we were fortunate to receive some rural health funding in Franklin County, and that funding allowed us to complete an in-depth needs assessment. We had peer input, we had consultants and advising on what were the strengths and what were the gaps in this rural community. And as we completed this assessment, what really seemed to stick out most to us was the availability for people to connect and move through a continuum of substance use disorder, addressing concerns, treatment, recovery. And so we continued that work as we were awarded more funding to implement a peer service program. We couldn't have done that without the support of our peers, as Nichole mentioned, to help kind of give us what are some lessons learned in the world of certified peer specialists, what they think are best practice models, what's worked, what's not worked. And through that, we've been able to develop a pretty robust peer service program in Franklin County. And we continue to consult with the peer work that's happening across the eastern region and continue to look at ways we can expand that work and grow and help people that might be struggling in the community. In addition to that, we've relied on peers and connected with peers through networking, through growing and supporting other avenues such as MoPros, a coalition of peers, and figuring out how we can connect peers that were building their capacity in Franklin County. How can we connect them with other peers that are already doing this work? And PreventEd has always supported MoPros. When we could have in-person meetings, we would share our office space with them. We've offered some technical assistance help with things like strategic planning, and we continue to find the real value in working with peers.
We're so grateful for this award, and we look forward to many more years of future partnerships.